There really is not a simple no-go or go decision regarding participation in healthcare exchanges and healthcare benefits for employers going forward. There are a number of factors that, depending on the workforce of the employer, their location, and their approach and commitment to their employees, will drive a decision as to how they want to treat healthcare based on the Affordable Care Act, the exchanges, and the availability of these new models beginning in 2014. The exchange models available today offer various levels of service, various types of insurance, and various carriers. They also offer various types of underwriting, and the cost to both the employer and the employee can be very different. So the exchange models today are not all the same, and in fact many of them are still developing. What happens in the marketplace is that the concept has outpaced the actual development. So many employers are hearing about these exchange models, and even the public exchanges, it is not clear from the government exactly what they're going to look like. So it's difficult today to make a solid decision regarding the exchanges because the models are in fact so different. For some employers, maintaining traditional health benefits the way they do today will certainly continue to be a viable option. They will need to decide, again, based on the profile of their workforce and the competition in their industry, what the right decision is for them. Some will believe that the value proposition of their employees is important enough that they're going to maintain the model they have today. The biggest factor, as I've alluded to, is the concept of what the commitment is to the employee and their value proposition. So, does your workforce require health care? Is it important for your recruitment and retention strategies? Does providing specific programs around wellness and initiatives really improve and matter to the productivity of your workforce? After that, the decisions become a bit more cut and dry in terms of what you might be looking for from an exchange partner. These factors of decision absolutely will affect the employee. The biggest one of these is around the low-income subsidy. So a workforce that has a lot of lower-paid people, if you offer health benefits to those people, you are in fact excluding them from taking advantage from the government subsidies when they become available in 2014. Another major factor is around part-time workers. So the Affordable Care Act allows you not to offer benefits, health benefits, to workers who work less than 30 hours a week. We're seeing a number of employers who in fact are looking more at managing their workforce down so that the number of full-time employees is less and the number of part-time, non-benefits eligible employees is greater. So there are meaningful decisions that will significantly impact employees, not just the employer and their cost, as they move forward in analyzing the new marketplace.